topic is Streetswork and AIDS and HIV. Of course, we have Ms. Spearman, Ms. Anderson, and Mr. Harleston, all organization members from Streetswork, an organization that is headed by Mr. Ron Crowder. Of course, Mr. Harleston, I think you were giving us, when we ended this first segment, some information in reference to coming to Nashville and some of your activities as an outreach coordinator in a real sense. Let's have you to talk about HIV and AIDS and the way you see it in terms of some numbers and how it has impacted other folks and et cetera.
Okay, in terms of numbers, let's say Washington, D.C., for instance, 1 in 20 infected with HIV, and in terms of black men, 1 in 7. Here in the Nashville area, it's 1 in 30 for black men and 1 in 160 for black women. And those rates are increasing, especially among crack-addicted black women and the older population, because the older population seem, you know, that they're past that stage. And no one's past the stage of becoming infected with HIV. I think there's 40,000 newly infected HIV cases in the United States per year. So at that rate. You know,
and so in a real sense, what we're dealing with, Mr. Harleston, is a real epidemic.
Yes.
That people somehow, we hear people talking about HIV, AIDS every now and then, and while we're simply casually discussing it, the numbers are increasing. Is that a correct assessment?
Yes,
of
that is
what's going on?
correct assessment. It is increasing. That is one reason why we do the outreach, because people really have to be educated. You know, they have to be educated. The stigma has to be broken down, the stigma that is attached to HIV. They have to be educated and taught prevention techniques. Those barriers toward prevention have to be broken down so that, you know, these people would readily practice safe sex practices. That is probably a main reason, because there's no cure for it right now, as we all know. So our best hope for it is either prevent the spread or prevent newly infections. And the way to do that is through education, scientifically based education, because it's a known fact.
You know, Ms. Anderson, when you talk about being an individual that's interested in clients, you're talking about dealing specifically with individuals that have either been impacted by HIV or by full-blown AIDS and et cetera. What are some of the characteristics that you can tell our audience this morning in terms of who these individuals are, and not necessarily how we identify them, but how do they live in that kind of situation, as much as you care to give us this morning?
Okay, well, the majority, like Mr. Harleston was saying, is people that are addicted. They tend to not seek the help, you know, regular doctor visits, medication, so the disease progresses. So my goal is to make sure that they get their basic needs and be able to get around to get to their appointments. You know, some want to go back to school, so we make sure that they get back and forth there. You know, provide them with food until they can get on their feet, because our goal is to get all of our clients to self-sufficiency so they can support themselves. So right now, we're just trying to help them along the way.
Now, in dealing with these clients, do you find that this to be a very, very expensive disease individually among each individual person? It costs a lot to deal with this particular individual with this particular disease. How do you find that to be? Is it expensive to deal with it? Is the medication expensive?
I think it depends on the medication. It depends on the medication. Because I'm not on medications, so I really can't say on that part. But just hearing the different clients speak of it, some could be very expensive, and a lot of the clients depend on TennCare in order to get it paid for. But if they don't have any insurance, then they don't get any help. You know, so we try to help them, you know, give them the push, hook them up with other agencies that might can assist them in that area.
And so what you're saying here is that you have to have a broad range of agencies outside of Streetswork and et cetera, simply to help coordinate and getting persons over here who might need food, somebody over here who might need housing, somebody over here who might, and so you need almost every aspect of any kind of public situation that the government's involved in.
That's correct.
And of course, now, I think, Ms. Spearman, we've all talked time and time again about trials and how to be able to one day find some kind of vaccine for this. How do we stand in reference to that?
Well, at this point, we're still at a process now where we're still having clinical trials trying to determine different vaccines that's able to either slow this virus down or to keep it from progressing within the body. At this point, it's like I said before, it's in process, but there is all types of information available to educate the public about vaccines that are available to help the situation regarding this disease.
What are you finding in reference to the individuals that you reach out for? Do they have any real problems in housing or any problems in
definitely.
Food and problems,
Definitely.
you know, the kind of social problems that people need to live in spite of the disease? And
like quite a few of them are not only HIV infected, but there are many of them that have other personal issues, mental health issues, addiction issues, alcoholism issues, and those issues also have to be addressed too. Housing in particular, because if a person does not have stable housing, it's very hard for them to have a central place to operate from, you know, feel secure. You have to have like a stable base of operations before you can go to the doctor regularly and do all the necessary things you need to do for yourself. They have some of them do have difficulty with getting their medications. Let's say you take an individual whose confidentiality has been broken at his job, and people over there are stigmatized about HIV, and he loses his job. Now it's a real big issue. So, and if he's living from paycheck to paycheck or even month to month, you know, next month, he very well may not have a place to stay. So here at Streetworks, we assist them in housing, food, transportation. We do HIV. We do just whatever it takes. With the education and the prevention, we even, if it's necessary, if an individual wants us to come to their home, we will get in the car and come to their home. Whatever it actually takes for that person to get the necessary services they need in order for them to live a healthy life.
Okay, very good. And of course, when we come back during this final segment, Mr. Harleston, we'll have the three of you to talk about what you consider to be some of the efforts that can be made. See, you're working with this problem, and by now you ought to have some ideas as to what the community can do in order to assist you and et cetera. And so we'll be back with our audience following this very, very short commercial break. We're talking to Mr. Harleston.